presentation is concerning a prostate biopsy. If you need to have a prostate biopsy, this has been ordered because there is a possibility of prostate cancer. PSA and rectal examinations only raise the suspicion of prostate cancer, but to make a diagnosis, tissue must be seen under a microscope and cancer positively identified. To do this is relatively simple, as the prostate sits just in front of the rectum. This is why the prostate's easy to feel through the rectum, and it's also easy to take a biopsy. It's a simple test that's performed under a short anaesthetic, so we do not expect you to be aware of the procedure or to have any discomfort. Once you're asleep, the prostate will be re-examined and a probe inserted into the rectum. This is an ultrasound probe and will allow us to see the prostate very clearly, not only in the area near the rectum but throughout the whole gland. In a standard biopsy set, 16 biopsies will be taken. More may be taken for larger glands or if there is an abnormality. Prostate biopsy is not without risk or potential complications. Pain is uncommon but is usually managed with simple analgesia such as paracetamol or anti-inflammatories. Bleeding is common and patients should be off all anticoagulants prior to a biopsy. Bleeding does tend to be short-lived and is not severe, but all patients will see blood in the urine and or faeces for around 2 to 3 days. Patients will see blood in the semen for up to 15 ejaculations. This is quite a long time for most patients. It gradually decreases with each ejaculation, but does not present a risk to yourself or your partner. Infection can be seen in biopsies, and this is the true potential complication. The infection rate in our series in Western Australia is 1 in 200, which is comparable with current literature. When infections do occur, they can be serious, and a true septicemia or severe blood infection can result. Antibiotics will be needed, and these need to be given in a hospital intravenously. We also give prophylactic tablet antibiotics to reduce the risk of infection, and it's important that these are taken as directed. You'll be given instructions on the day of presentation to hospital. With septicemia, you would be unwell with high fevers, you would be sweating, and you would have headaches. This is usually a significant illness, and it will not be a mild change. This tends to occur after the biopsy with a delay of around 24 to 48 hours. If this does occur, please contact the hospital immediately and you will be admitted for intravenous antibiotics. The infection rate remains relatively low in Western Australia. However, the bacteria that we are seeing tend to be resistant to the standard antibiotics, hence the need for admission to hospital. It's impossible to completely eliminate the risk of infection. However, taking your oral antibiotics give you a good degree of protection. Some of the bacteria that we see are resistant to these antibiotics. It's important that we reduce the risk of contamination by keeping the rectum clear, and if you've had a soft motion on the day of the procedure, then this should suffice. If your bowels have not been open, please inform the nurses on your presentation to hospital, and an enema will be given to cleanse the lower rectum. Full bowel preparation has been advocated by some. However, this has not been shown to reduce infection rates and can complicate anesthesia, as typically there is some dehydration associated with this.